Good morning, everyone. Keratorefractive lenticule extraction with the introduction of femtosecond laser. This procedure has become the mainstream of corneal refractive surgical procedure, and it in CLEX or keratorefractive lenticule extraction, we use the femtosecond laser to create the corneal lenticule according to the patient refractive error, which is then manually separated and removed through a small incision of 2 to 3 millimeter. Currently, we have 4 platforms available to do the CLEX procedure. We have Smile, Silk, Clear, and SmartSight. In our study, we did the procedures with this. We did Silk procedure. In Silk, it is smooth incision lenticule keratomiliosis. We create a biconvex lenticule with a low energy, high frequency laser with minimal spot spacing, and thereby it creates a tissue bridge-free cleavage with a smooth separation, and it preserves the corneal biomechanics in a better way compared to other types of refractive procedures. Our aim of the study was to analyze the outcome of the refractive and the clinical outcomes of Silk in correcting myopia and myopic astigmatism. It was a retrospective study, case control study of 110 eyes of 58 patients with myopia and myopic astigmatism were included from August 2024 to November 2024. It was done at a tertiary eye care center in Kerala. All patients underwent a detailed pre-op examination, including uncorrected distance visual acuity, corrected distance visual acuity, slit lamp examination, dilated fundus examination, undilated and wet refraction, corneal tomography, tear film assessment. The inclusion criteria: the patients above 18 years with a stable refraction for minimum 6 months to 1 year were included, with myopia, the spherical equivalent within -10 diopter, and astigmatism less than 3.5 diopter were included, with a minimum corneal thickness of 500 microns. The patients with uncontrolled diabetes mellitus, keratoconus, other corneal dystrophies and degeneration, significant dry eye, prior ocular surgeries, uncontrolled glaucoma, pregnancy, lactation were excluded from our study. All surgeries were performed without intraoperative complications by same surgeon. The patients were reviewed on post-op 1 day, 1 week, 1 month, and 3 months. Uncorrected distance visual acuity retinoscopy were assessed on all reviews, and the dry eye assessment was done at 1 month and 3 months. Coming to the results, preoperatively 100% of the patient had 6/6 vision, which on post-op day 1, 75.5% had 6/6 unaided, which improved to 86.4% at 1 week, and which further improved to 95.5%, and it was maintained even at 3 months. Among 110 eyes, 105 eyes were aimed for emmetropia, and the other five eyes we aimed for undercorrection due to inadequate corneal thickness. In that, 79% had uncorrected visual acuity of 6/6 on day 1, which improved to 90.5% 6/6 on 1 week, and 100% achieved 6/6 at 1 month, and it was maintained till 3 months. Postoperative month 3, 100% eyes had a manifest refractive spherical equivalent within plus or minus 0.5 D of intended target with low variability. The accuracy and the stability of the correction were also demonstrated, with 97% of the eyes within plus or minus 0.5 D of target for mean spherical equivalent and cylinder at 3 months. Coming to the discussion, Silk or the CLEX procedures, it causes less as we are not making a flap of 300 degree, the damage to the corneal nerves are very minimal, and it gives faster corneal nerve regeneration and less dry eye, and faster visual acuity was observed in our study, and it preserves better corneal biomechanics as the anterior stroma and the Baumans are not disturbed much, and all of the patients maintain pre-op contrast sensitivity. We have noticed that the energy titration is the key to achieving optimum and rapid visual outcomes in silk procedure. To conclude, it is a consistent and safe and effective procedure for correcting myopia and myopic astigmatism. And the limitations, hyperopic corrections are not possible as of now, and we need a longer term studies are required to show the stability of refractive correction. Thank you, Spirit.
Oh, it is better than a smile. What are the advantages?
We don't have smiles, sir. We are doing silk. So there is no comparative study.
Comparative
We
studies,
haven't done a comparative study.
Because they are claiming that smile is better for myopia and astigmatism correction.
I don't have a
Central corneal thickness, what is that relation? You have to compare so many things, parameters. Central corneal thickness and then silk.
Central corneal thickness, according to the refractive error, we go up to maximum 100 microns for the lenticule size.
Okay.
Depending upon the patient error, a few patients we have done under correction also because the corneal thickness was not adequate for the power. So maximum we go up to 100 microns for the lenticule size. Otherwise, we don't do, or if the patient is willing for under correction, we can proceed.
Okay.
Thank you so much, ma'am. And you perfectly presented the paper. Whenever you present a paper, it has to be IMRAD protocol. Introduction, methods, then comes your results, then discussion and conclusion. You rightly presented that. Only one thing I would suggest next time when you present your data on sale, so there are the defined indices to present your safety and efficacy. Right? For example, if you go by, I was just going through that on that website. If you want to give the safety index, so it's supposed to be PCVA divided by pre of PCVA, they multiply by 100. So if you present your data as per those indices, then that will become more catchy. They can connect with that, and it will give more value to your study. And only one thing, I think when you're presenting paper, your discussion said this has less dry eye, but you did not show any data or for your patient, so that cannot be said based on your study, because I think you did not check for dry eye, or you have checked.
Quality, we don't have this. I don't have the data for the dry eye.
So your study should conclude that silk is safe and efficacious in patients.
It was a preliminary study. When we started, we did this in the initial phase.
Then your
Now the
conclusion
next.
should be based on our preliminary result. Silk is a safe and effective procedure for myopia. Dry eye or other thing that cannot be commented based on your study.
There's no
Or
data.
otherwise,
There
it's
is
a nice study. Thank you.
I'll skip, ma'am, in the interest of there's a conflicting interest. I'll skip.
Thank you.